terms of what we set out to do initially, which was to implement this brand new concept, it's not bad people, it's bad systems, change our systems, we've really made a lot of progress. We've made a lot of system changes in the last 10 or 12 years. The IHI 100,000 Lives campaign was a big success, there's no question about it. And those hospitals that participated learned a lot about how to implement safe practices and have continued and have built on that. The work that Peter Pronovost did in Michigan, I was chatting with Gip Campbell about this a few minutes ago, it still is a landmark in terms of proving that we can get to zero. Nobody believed it before that, but when the Keystone Project in Michigan was able to have 68 hospitals that went 6 months without a single central line infection or a single ventilator-associated pneumonia, that was a watershed event in patient safety. It broke the myth that it was not possible. We're now, of course, trying to replicate that nationwide, as you all know. Similarly, Atul Gawande's surgical checklist has had a huge impact, not just in the United States, but around the world. So these simple things, like really implementing a safe practice 100% perfectly, 100% of the time, using a surgical checklist, a timeout, these are very simple things that had huge impact, which of course is tantalizing in terms of thinking what would happen if we could do this with all of the different areas that we know about. But recently we've seen a very sincere developing interest in preventing hospital-acquired infections with, I think, some very big hits all over the country. We've seen a big reduction in Massachusetts. CDC said there's been a reduction. Excuse me. And so I think that we really are making an impact there. I'm very impressed with the few exemplars we have: Virginia Mason Medical Center, Children's Hospital, Cincinnati, and Ascension Health System are three that immediately come to mind. These are institutions that have really transformed themselves, and as they've done that, they have indeed been able to achieve great progress in patient safety. And certainly the National Quality Forum has been a hugely important resource. In the absence of government involvement, it has really performed the function of standard setter to identify, to validate, and certify safe practices, so that nobody can say anymore that they don't know what to do. We have an agenda, there's no question about it, we're working on it, and a lot of good people have done a lot of good work.